Hey everybody, for this video we're going to be talking more about what our nerve scans do and how this relates to the symptoms that our patients are presenting with. So here at Vitality Chiropractic we use a very specific type of scanner. It's called nerve scans, and this is technically the technology is thermography. Really, if you're going to get really into it, it's computer thermography, and it's to let us see exactly what's happening within the nerve system. So essentially what this device is doing is it's testing to see if there's any level of nerve interference, especially one which may be caused by interference in the brainstem. To get more into this, it's really where parts of the brainstem which control some of those small blood vessels that you have running through the skin, they can vasodistrict and they can vasodilate at different levels. If they're going to be more constricted or more closed, that area will not appear as warm. If it's going to be something where they're more open or it's more dilated, then it will appear warmer on the scans. So the simplest level, thermography is really a very, very sensitive test at infrared level of what's happening in terms of temperature from side to side. And the research shows that this is more of an indicator of something happening at the nerve system. Because say if someone has had no exercise, they've been at rest, they've actually had a time to acclimatize, such as we have here in the clinic, then they should have a pretty equal temperature from side to side. Based on the research, it should be within a difference of about 0.3 degrees Celsius from side to side. However, if there's something going wrong with the nervous system, especially at the brainstem, it may be irritating those nerves and it may not be able to have that autonomic control over other parts of the body. And when this is happening, it's going to start to affect those small blood vessels, especially the ones that are located in the neck, because there's such a high concentration of nerves in this part of the body. So if there is this kind of change, we may start to see these big swings in the actual scans instead of being nice and straight, and we may start to see patterns forming over time. Again, of course, it's something we have to do more training for, something we really have to do a lot more time to learn how to take and how to read these scans. But the simplest level, we want to see nice straight lines and the body in balance, because when this happens, this is where thermography is showing us that things are okay. However, if there are times where there is no balance, where maybe there's those big swings as we talked about, or the body is showing a pattern, especially a more negative pattern, then this pattern is going to be something which indicates there may be a problem in this part of the body. And of course, this is what we specialize as chiropractors, as the misalignment of this top part of the neck can then cause that kind of interference in the nerve system. Now, when people are coming in to see me on a daily basis for their regular appointments, this is what we're going to be testing at every single visit. At every single visit, we'll not always be going through what's happening in terms of symptoms, especially if it's a long-term and more chronic case. Because if it's always addressing what's happening with the symptoms, that's not really going to see objectively what's happening with the body. An example of this would be, say, somebody has a heart attack. So of course they go to see their doctor, and afterwards the pain goes away, but the doctor keeps doing checks on them very regularly, doing blood checks, doing blood pressure tests, also asking them how things are going in terms of their daily life, not in terms of symptoms, but in terms of how they're able to conduct themselves in different activities, whether it's exercising, working, spending time with friends, all of these different factors. All these more objective findings, these are going to be the way that the doctor will decide how they should proceed forward. If someone does have, say, a high blood pressure problem, they're going to be checking their blood pressure, and they're also going to be checking their bloods and their blood work at regular intervals, and they're only going to be changing their medication and the other prescription and other lifestyle advice that they give them based on those tests. It will not just be based on, are you having a heart attack today? It's not just been following the symptoms, it's really following more of the objective changes happening in the body. It's the same thing here at Vitality Chiropractic. We are really following more of those objective changes in the body, really seeing what's happening on the nerve scans, not just following the symptoms. Because it's very common that the symptoms may go up and down and they may change over time. This can be due to a number of reasons. It can be due to the healing stages of the tissues, as the tissues do heal at different levels, depending where they are, whether it's nerve tissues, stomach tissues, muscular tissues, connective tissues, all the other different parts of the body. And the other aspect of this as well is that as well as it being due to those changes in the different tissues, it can also be due to the changes in the cycles of the body. This is for men and for women. We can have hormonal changes going on, digestive changes, as well as how the linings change, say for blood vessels and for the stomach and for other parts. So all of it can follow along with that. I would always think of it a bit like the stock market when it comes to symptoms. It's not expectant that we can have an instant change and everything changes straight away. And then it is normal that things may go up and down over time. But as long as they're going up and down and gradually getting overall from here to up here, then that's going to be the main kind of goal that we have. If anyone has any other questions about this, of course you can put this into the comments, or you can give us a call at 8438-9550 or help@vitalitychiropracticcentres.com. I'll be happy to get back to you, either to talk more about what's happening on our scans or to explain how we possibly can help you with some of the symptoms you're having and how those scans, of course, would correlate into improvements in your symptoms as well.